Carol, there are four main ways that people with fibromyalgia can be supported and treated. There's, first of all, and most importantly, the educational component, getting people to understand the condition. Secondly, there might be psychological support, perhaps cognitive behavioural therapy, and you mentioned in the previous part of the interview about keeping positive and so on and so forth. Patients might have some physical therapy needs, and of course there are drug treatments that are available. I wonder if you could let me know what your experiences are of all four components, because it would be interesting from a patient's perspective, because they have to take medication if they choose to go that route, and we know that the medications that are licensed in this condition do actually have some major side effects. So perhaps you could tell us a little bit about how you manage with exercise and what your experiences in the past have been with medications and other help that you've had.
Initially, when I was diagnosed, I was given drug treatments to try. I'm not one for taking medications because I've gone through that phase of taking too much medication that was the only coping mechanism I had, because it was the only thing I was being offered by my GP. However, new medications came in that make it a little bit more easier to manage. I've tried the amitriptylines, which they kind of went for my irritable bowel syndrome more than actually anything else. I've tried the gabapentins and the pregabalins, and again they gave you that zombie feel in the morning that it took at least 2 or 3 hours to function. Sometimes you got a good night's sleep out of it, but at the same time you could hardly focus in the morning. So the tramadol's strong painkiller again gave you that sort of onset sleep fatigue. So I wanted something that could manage the pain, that I could be able to do day-to-day tasks. I was then referred to a pain management programme, residential, in the Brecon, and by my pain consultant, and it was the best thing I ever did, because it gave you a tool that you can then run with. It gave you a way of, yes, not looking at what you can't do, but how you can do it, but in a different way. That if you want to do 2 hours ironing, it was do it in 4 stages of 20 minutes. It was just a total different light onto how to manage the condition. Sleep patterns, it told you how to do relaxation techniques. It told you how to sort of slow down rather than keep running. And if you've got a good day that you feel really, really refreshed, not to overdo it on that days. Exercise, I was referred to an exercise programme, which was 20 weeks. And it gave you a bit of a boost in your energy levels, but it also gave you that reason for, well, I can go to the exercise programme, I can work certain exercise equipment in the gym, as well as I can walk further, because I know how to walk, I know how to pace myself when walking, I know how to do exercise a slightly different way. I mean, weightlifting, you can never do that when you've got fibromyalgia, because you could struggle. You could probably pick up 2 bags of sugar, but that's about your maximum, because heavy weights would actually pull at your muscles, and that's the last thing you want, is to be doing a bit of exercising to then be 3 days in your bed because you've overdone it, which tends to happen with people with fibromyalgia, and myself included, that when you feel good in a day you tend to run fast, and then you're waking up the next morning and think, I shouldn't have done that, I should have taken it a lot slower. So by going to pain management courses and doing certain behavioural areas, I haven't had the need to do any psychotherapy, because I've learnt at the moment, I may need it further down the line, when I can't cope, should symptoms get stronger or get bigger, or I'm slowing down that I'm unable to cope anymore, But at the moment I haven't had psychotherapy because I've learnt to actually manage the condition myself by just saying no to myself. I can't do that, but I can do it this way. And just by changing attitudes and just changing a way of working has made me feel that I can still fulfil a normal quality of life. I can still go on holidays, I can still keep a job, and I can still do things with my family that, you know, maybe 10 years ago I couldn't do at all. So there's been quite a few different changes to the word fibromyalgia and what it means to myself, in what I can do and what I can't do, and I need to focus more on what I can do. And now with the education of fibromyalgia being a bit more, having its own pedestal and being a bit more recognised, a bit more talked about, so when you go to a GP and you mention the word fibromyalgia, they've got a little bit more knowledge of what that actually means to say, well, this is what we now need to do because you've got fibromyalgia, and not just blame everything on fibromyalgia. They're now looking at it as, if you have a new symptom, that fibromyalgia means that we can treat the symptom in addition to fibromyalgia and not just blame it. So it's made me feel a lot more confident in the GP's awareness of fibromyalgia, which means that whenever I get a new symptom and I can't cope with it, I know that they know what I'm talking about, and I've got a little bit more trust in them again.
Okay. One thing you haven't mentioned is any forms of physical therapy. Have you any experience of physiotherapy or?
I've got some physiotherapy because I twisted my ankle, and I've also got my knee, was it patella, is slightly out because I had a fall, and I see the physiotherapist, but it does take a little bit longer because you've got fibromyalgia and what the actual chronic pain with the muscles and things around it. So when you twist your ankle, instead of being maybe 2-3 weeks and then you're fine, it may take a month and a half to recover.
Because of the sensitivity that you have to pain.
And I think, so when you get physiotherapist treatment, you have to prepare yourself that it won't be a 4-week program, it may be an 8-week or 10-week program, that you need to learn how to just take things a little bit easier so that the physiotherapy treatment that you get, I've tried hydrotherapy as well,
right.
And I felt the benefit from hydrotherapy, but there isn't many hydrotherapy pools out there that you can actually go on your own rather than through a program.
What about ordinary swimming? Does that help?
Sometimes, but again, if the water's too cold, it tends, because with fibromyalgia, your hot and cold sensitivities can be affected. So even although the water's tepid, it may feel really cold to someone with fibromyalgia, which means it may slow them down or take a lot longer for them to warm up to be able to swim 2 or 3 lengths. Unfortunately, I'm not a swimmer, but I do try my best to get as much as I can out of swimming, because they said that was the only overall exercise that would actually benefit all the muscles and all the body. Sure. But again, it's trying to find a balance of sort of doggy paddling and trying to see the benefit of actual swimming. And that's why I think the hydrotherapy pool was better for me, because one, the warmth, which was fine, but two, the resistance that you get with doing exercises under in the hydrotherapy pool, I felt a huge much benefit from it. But again, as I said, there isn't much hydrotherapy pools in Wales and programmes that will actually refer you into hydrotherapy pools.
Sounds as though what you've done over the years is find small solutions for yourself in lots of different ways, and keeping yourself very positive probably also helps. Are there any tips that you would give us doctors to encourage our patients to follow that route? I
think once a doctor has a full understanding of the actual condition itself, but they need to understand what it means to that patient. What it's like for that patient to just get up and do day-to-day tasks, like dressing, bathing, going to sleep. And listening skills is the biggest thing that GPs need to listen, and not just put everything down to fibromyalgia, because they may miss things that might not be just down to fibromyalgia. And not leave the patient sitting on their own with, well, there's a treatment, there's medication, there's, get on with it basically. The GP needs to be a lot more supportive role into that patient, and the GP needs to be more understanding, especially for family members, especially if that person has got a young family, because or if it's a male perspective, because males are often breadwinners, and now they've got to take a step back and allow the wife or the partner to then take over the running of the home, which is what their role is. And sometimes it's difficult more for a man to actually have a condition, to be supportive, but also to accept that this is what it's going to be like from now on. You just need to manage it, and you just need to take each stage as it comes, and not just concentrate on the pain. Look at how you can block the pain out, by doing some walking or doing some reading or getting a hobby, and just completely taking your mind off focusing on the condition and focusing on, well, today I've had a bad day, tomorrow's going to be even worse. No, tomorrow could be better, it's just how you manage it. And having a better of a supporter role, and I do think support networks and support groups are key, and GPs need to know where support groups are in their area to refer patients to that support groups and support networks, because they're the biggest hub for information and coping mechanisms. And I think GPs need to know how to refer patients on to, be it CBT or physiotherapy or pain management or expert patient programs. But if GPs don't know what's in their area, don't know how to refer patients, then the patients are sitting at home, like I was initially, sitting at home on their own with no support at all, thinking, well, what do I do now? What can I do? My GP doesn't listen to me, doesn't understand me. He just keeps giving me prescriptions, and he's not really looking at what I want. So I think the GPs would benefit more from a listening skills, and more from education on finding out themselves what fibromyalgia actually is, but also finding out more as to how it actually affects that patient and their quality of life and day-to-day things, so that they can maintain, the overall good of keeping a job down and keeping their family life, and just keeping life as it was before the actual condition.
Thank you.